Assalamu alaikum everyone. Finally, we are going to provide necessary information about the nervous accessories. And the nervous accessories is 11th cranial nerve, and it's pure motor nerve. Okay, it consists of two fibers. One fiber is connected with nervus vagus, and second one is pure accessories nerve. Okay. First of all, I'm going to talk about the main function of the nervus accessoris. The main function of the nervus accessoris is supplying the muscles. The name is sternocleidomastoideus and trapezius with nerve impulses. Okay, according to these nerve impulses, this kind of muscles will contract and perform some kind of functions. Okay, first of all, look at that, and the primary fibers will be generated in the right hemisphere, and it will descend to the brainstem, and the small amount of fibers will continue in the ipsilaterally, and the large amount of fibers will continue to the contralateral side. Okay, in the contralateral side, they connect with the secondary motor neurons. The secondary motor neuron in the nucleus ambiguus is responsible for contracting the laryngeal muscles. That's main function is generating the voice. Okay, and these fibers will exit from the brainstem and can join to the accessory nerve, and when it exit from the jugular foramen, it discharge from the nervus accessoris and continue its pathway in the nervus vagus, and its main function is contracting the laryngeal muscles and generating the voice. Okay, now, and the next fibers are connected with these alpha motor neurons and C2 motor neurons, C3, C4, C5, C6, and etc. etc. Okay, and all of these fibers C2 from the C2 to the C6 or 5 is responsible for contracting the sternocleidomastoideus and trapezius muscles. Okay, now after exiting between the anterior and posterior root, they combine with each other, and after combination, they generate the nervus accessoris and they exit from the jugular foramen. And these nerve fibers direct to the sternocleidomastoideus, and after that to the upper part of the nervus trapezoideus, and another part of lower part and another part of the nervus muscle trapezoideus muscle is innervated by C2, C3, and C4. Okay. Now look at that. We should talk about some kind of lesions that relate to nervus accessoris. First of all, the most common disturbance can be caused by the iatrogenic, that's during the biopsy, taking the biopsy from this side, from these lymph nodes. Okay, during the biopsy, the nurses can injure the nervus accessoris, and the function of the nervus trapezoideus will be impinged. Okay, for example, the main function of the nervus trapezoideus is holding the shoulders in the normal position and elevating the upper limb from the above from the 90 degree. Okay, from this side we couldn't elevate our upper limb. Okay, and the shoulder will drop in the affected side. Okay, now, and you can find out the atrophy of the upper part of the nervus trapezoideus. Okay, now, and some lesions may happen there, and in this situation both trapezoideus and sternocleidomastoideus couldn't perform its normal function. Okay, now the main function of the muscle of the sternocleidomastoideus is rotating the head to the opposite side and turning the head in the ipsilateral side, and holding your breathing in like that, and elevating the head during the lying. Okay, and all of these four for functions may be impinged on due to the lesion of the accessories nerve. Okay, that's the external peripheral lesion. I should talk about the central lesion. Imagine some kind of lesion may happen in the hemispheres, in the right hemisphere, and not all of the function will be diminished in the contralateral or ipsilateral part because and these fibers is arrived from the right hemisphere, and maybe 20%, and they are 80%, and the lesion in the right side, and most of the fibers, 80% of the fibers couldn't perform its function. However, from the left side, this kind of fibers arrive. This kind of fibers arrive like that. It's 20%, and they are enough to maintain the normal function of the muscles in the contralateral side. Although its function isn't so fully, but this kind of impulses will be enough to hold in the normal position of these muscles. And all of the information for you is all. Thanks for listening and watching. I hope and I believe that you can use this kind of information in your future career as a neuropathologist or another healthcare profession. And if you have any offers or suggestions, and if we have some kind of problem with our video preparation or some kind of mistakes, we are always ready to accept from you in the comment part of our YouTube channel. Thanks for listening one more time. Take care of yourself.